Hello, I'm Gina Ryan, Director of Hardin County Educational and Community Television. Welcome to this edition of EC3 Hosa Medical Moments. One of the reasons that we produced EC3 Hosa Medical Moments is to showcase our students involved in our health science classes. It's one of our most popular pathways at our EC3 location. In this episode, you're going to see many of our outstanding health science students teaching other health science students about the many career possibilities. So let's take a look at the EC3 Health Capstones.
Hello, my name is Megan O'Daniel, and I am one of the health sciences instructors at EC3. I teach pharmacy, phlebotomy, and EKG technician. All those are certification pathways through a national exam. And for a couple years now, I've been working on a capstone project. There's been a huge push in project-based learning throughout the nation, and more schools are going toward that type of learning. So 2 years ago in 2020, I began these projects in a dream that we could present these to the district and kind of have like a fair, but then COVID hit and we were not allowed to do this kind of setup. So things have been kind of rocky getting to this point, but so far I think I've been very proud of what the students have accomplished and the fact that we were able to do this year. And these capstone projects are very well turned out. They are a nice review right before they take their exam, because reviewing all that material just is not particularly fun. But this is a way that they can be creative, and hopefully things that they forgotten at the beginning of the trimester now has finally sunk in.
Hi, I'm Katie Skaggs. I'm a nurse educator at Baptist Health Hardin. I have been there for 11 years.
Hi, I'm Jenny. I am also a nurse educator at Baptist Health Hardin. I have been there 18, almost 19 years.
We got the pleasure of observing the nursing assistant program here at EC3, and I was very impressed with the skills that they had learned that I did not learn until I was in nursing school.
We also were able to attend their capstone fair that they had. And at that fair, the EC3 students had 3 different topics that they were discussing today: phlebotomy, EKG, as well as pharmacy. Each of them had a poster that they had worked on together, and we were able to go around and they could just tell us a little bit about their poster, what they liked about that topic, and we were able to ask questions. We were both very impressed with the students and the way they answered the questions. They had put a lot of hard work into those projects.
Very creative and beautiful posters.
Hi, I'm Carly Price. I'm a senior in the pharmacy tech pathway at EC3.
Hi, I'm Emily Mom. I'm a senior in the pharmacy tech pathway at EC3. First of all, the main points we have is history pharmacy, inpatient and community pharmacy, and modern pharmacy and pharmacy laws. History of pharmacy is more or less like concoctions or other medication they have made like before, like in the past, like centuries ago, such as like we used to use tiger fat for joint pain, and wine and peppers are such as stomach problems, and we also used garlic for inflammation. And trephining is a type of like procedure they used to do, such as like where they'd cut a hole in the back of your head, and they used to think evil spirits was living or was the cause of your sickness, so they would cut a hole to get the sickness out. Responsibilities is such as like inpatient and community pharmacy. Inpatient is more or less of like in a hospital setting, you're going to be like in a basement and a morgue, so you're not really getting so much social, so it's better for people who are not social. community pharmacy is such as like Kroger's, where you're going to be dealing with a lot of people, so you're going to have good people skills, such as like being nice to people and always sitting there and explaining to people what their medications are and how it could interact with other medications.
So another big thing is modern pharmacy, and then it says an ever-changing profession, because with more technology and more medications, things change every day. The laws change, because now, like obviously, back when like people first started using medications, they didn't have robots to count out their pills for them or an electronic prescription. And then also there's a lot of different things with the laws. There's a lot of rules when it comes to controlled substances. And a big thing that made the Board of Pharmacy like start making so many different laws was the opioid crisis, because so many people were overdosing and getting addicted to opioids that they started like classifying medications to make it to where you can only get it a certain amount of time before your refill is up. And also the Board of Pharmacy like differs in every state, and it like each one caters to the needs of their own states, and there's different rules for each state. So like say if you could be certified in Kentucky, but you could move to California and completely like not be a certified pharmacy technician anymore.
Okay, introduce yourselves.
Hey, my name's Juliana.
My name's Hannah.
My name's Riley.
I'm Monica. Okay, so what is your project about? Can you tell me about that?
So we're in phlebotomy, and Okay. When you break up phlebotomy, it means like cutting into the vein. So I did the history of it. Phlebotomy started as bloodletting, and they would just cut into your vein and let all the bad stuff drain out. But now they do it in a more sterile way, and they'll test the blood.
And then I covered legal concerns, and we want to make sure that we follow all the legal concerns. That way we don't end up in legal trouble. Like informed consent is a huge one. You want to make sure that you have the consent of your patient, and you want to make sure that they know what they're getting into, like what you're going to do, the risks of or anything that can happen. And that's like, yeah. And then you want to make sure you follow HIPAA, which is the privacy laws, making sure that you don't like expose patient information or talk about them in public or anything like that. And then Riley.
I did the emergency procedures. I think it's one of the most important ones to learn in phlebotomy, because you have to know what to do just in case anything goes wrong. Basically, it talks about the complications of what can happen during a venipuncture. One of the most common ones is a hematoma, which is what this looks like. It's very painful but very common in blood drawing. Basically, it talks about the causes of hematomas and how to treat them when it does happen and how to prevent them. Another one is petechiae, which is also very common. This is caused by too tight of a tourniquet and many other things. I think emergency procedure is one of the most important things to learn, because you have to know what to do just in case anything bad happens. Monica?
Okay, I did, so whenever you think of like phlebotomy, you would think of like blood, sticking, so on and so forth. So this is kind of just shows everything that you can test out in your body that's not really blood or sticking related. Like you can do a urine sample and figure out, all down here shows all the urine you can do. And then you also can do feces to see if there's like blood in your feces and just other cool things that not everyone would think you would learn in that class. Okay, so when you think of phlebotomy, you think of like blood sticking, like always. But this area kind of just shows the type of like things that don't really involve blood or sticking. Like you can do a urine sample, and then down here kind of just shows the different types of urine you can do to test out. And then you can also do feces. You can test your feces. So yeah, I just think it's a cool thing to know that it's not just blood and sticking. And
All right, so what did you guys do for this here?
These are our 3D models. They're kind of like a blown up version of tubes once they've been through a centrifuge, which is a machine that spins the tubes around and basically mixes the additives in and separates them. So we have a serum tube, and it has serum and a blood clot. And then that one is a plasma tube, and it has the blood plasma and then a buffy coat, which is platelets and white blood cells and then red blood cells. And basically you would take any, you could test any form of that specimen for depending on what kind of tests you do. And then we also have the pictures up here, and those are just like things that a phlebotomist would see or use on a day-to-day basis. And we have these little cards that people can pull out and read, and they have the like corresponding information about the pictures.
Cool.
And these are the laws that come with it.
All right, thank you. So tell us a fun fact. Do you have a fun fact?
Yes. Hippocrates is the one that he basically founded most of the medical groups, including pharmacy or something. And he also was one of the first people to associate good hygiene with good health. And he also founded the four kingdoms, which is blood, yellow bile, black bile, and they equal air, water, fire.
Awesome. Thank you for doing this. Looks good. Good job.
Hi, I'm Reagan. I'm here with Haley,
Aubrey,
and Reagan. Please tell us about your phlebotomy tech.
So this is a phlebotomy. There's a few things that you need to know. These are the veins that you would draw from normally. And the order of draw, which is a very important part of phlebotomy, of course. They're in order.
Okay, so the order of draw helps us determine which tests need to be sent to the lab first. So obviously the ones in the front would like have priority versus the ones in the back. Our arm here is made out of PVC pipe and clay, so I think that's cool. And then up here we have pictures. So this was like the history of phlebotomy, so bloodletting back in like 1000 BC. Egyptians would like cut your arm and like let you bleed into bowls and stuff, but it caused like a lot more harm than it did good. And then over here we have the order of draw again. So like, and there's also a memory jogger for it. So like stoplight, red, stay put, green light, go. And that has to do with like the tubes and the colors. Here, we just have the veins again, just in case you need a better visual than what we have on the arm. And then this is a picture of modern phlebotomy. Does somebody want to tell about modern phlebotomy now?
That's pretty much what you would see if you like walked into a phlebotomist office and they were drawing somebody's blood. There's 3 different methods that you could use for venipuncture. There's the vacutainer method, which is like the normal method that you would use to like for like adults and just like normal sturdy veins. Then there's the butterfly method, which is just a smaller needle that you would use for geriatric and pediatric patients or people with just fragile or small veins. And then there's also the syringe method, which is a 21 to 23 gauge needle, so it could be pretty much any size. And it's for like people whose veins can't take the vacutainer, like the vacuum of the vacutainer. So we like pull it up like very slowly to make sure that they don't like collapse and like bust and stuff like that.
What about for the heel sticks? For like infants and newborns, you stick the heel and get blood out of their heel just because it's safer and easier for them.
This is Mackenzie, by the way.
Sorry,
a lot of us have 2 different projects going on, so we're back and forth.
I just thought you mentioned that one.
Yeah, that's about the rundown of like the important stuff that you need to know for phlebotomy.
We have the infection control, which is pretty much the same as any healthcare environment. Do the basics, and then we have the complications, which could happen to anyone.
That's pretty much it. Very nice. Thank you. Thank you. So, can you guys tell me your names?
Lillian Sanders.
Reagan Wells.
So, what can you tell me about pharmacies?
So there's a lot that goes into pharmacy, like a whole bunch. There's a bunch of different laws. We progressed a lot from the history into modern pharmacy, and there's a lot of people who accidentally came up with medicines that have saved millions of people. That's like the big stuff.
So, who are some people who kind of influenced today's pharmacy and pharmaceutical ways?
Benjamin Franklin, he came up with the idea to start like the first hospital pharmacy, so that helped a lot of people inside the hospital, and then after that we kind of branched out to more options, so we have like closed doors, nuclears, community, all that kind of good stuff. So from the hospital we branched out to having Walgreens and pharmacies inside of conventional stores.
So, what is nuclear pharmacy?
Nuclear pharmacy is medicine that deals with a bunch of radiation. So you have to have special training. You have to make sure you're extra cautious because radiation can be very harmful to your patient.
So, do pharmacies have laws that they have to abide by?
Yes, the biggest law almost any healthcare has to abide by is the HIPAA law. So you have to make sure that all your patients is confidential, nothing is talked about unless they sign a consent form. And then there's a lot of laws to prevent like selling narcotics without prescriptions, a lot of, harmful, painful drugs.
So, how has just the pharmacy and just changed over time?
So the pharmacy started out with people just mixing together whatever herbs they thought would work, and then it turned into them knowing and having all of them. It used to be that anybody could be a pharmacist. Anybody could do whatever they wanted. Now you have to have training and you have to follow laws when they used to not have to. You could just mix anything together and give it to somebody and be like, here's your medicine. So they changed a lot in that way.
So, what do pharmacists do?
A lot of pharmacists, they're normally, the pharmacy technicians will count the pills, grab it off the shelves, make sure it's the right one, calculate the dose, and then the pharmacist will go behind you and check. And then a lot of the time the pharmacist will reconstitute and add up the liquid medicine and stuff and get that all together, and we package and label them all the time. There's a lot that you have to do to make sure that the patient doesn't get the wrong medication.
So, what does it take to become a pharmacist?
You have to make sure that it's better to start off as a pharmacy technician and then work your way up to becoming a pharmacist. But you have to have your master's. I think you have to have your master's to become a pharmacist. So it's 6 years or more of school.
So, what is the Narcotics Act?
The Narcotics Act is put in place to prevent the sale of opium because they used to just give out medicine to anybody who asked, and then it became addictive, and there's a lot of addictive drugs, so they have to put bans on those. There's a ban on the sale of coke in a pharmacy. Even though we don't sell it, we have to have that in place because you never know. So it just prevents the sale of opium.
So, what is opium? Just a drug?
Just a drug, yeah.
Okay.
Just something that helps you.
Marijuana, it's addictive, and some of the properties of it can, I think it was a drug where people got addicted to it, and people had new changes in the mood and actions, and that just kind of went away from there, and people saw that, and they started to make it banned because it was effective on the community and the people.
So, accreditation, certification.
That's kind of just what we're doing. Accreditation is when a pharmacy is allowed to go through with being a pharmacy, and they have all their laws, they're following them, they get checkups, all that good stuff. And then certification is what we have to get to become a technician, just to make sure that we know what we're doing. We have all of our study tools, we have everything that we need to know to do a good job and not make as many mistakes.
Well, thank you guys.
Thank you.
You guys did an amazing job.
Model the exterior heart because we had to pick between 5 different categories.
So we had to use 5 different materials. So we ended up using this kind of felt and these weird materials. And then she let us use the stuffing as another material. These, we also had to have interactives. So we have little curtains.
Cute.
And they're kind of, you can also just flip them up if it's too much to push them to the side. And then this, we actually thought we could put leads, like actual leads and stuff, and let people take them off and place them where they go. Just in case nobody listens or can read. Yeah. Because like there's...
All right, see? I didn't listen or read. I want to tear up your poster.
No, it's fine. We super glued and hot glued all these on.
Oh.
But no, so we can let everybody, and then it looks like you're hooked up after they're all said and done. It looks like you're hooked up to the little EKG machine.
That's awesome.
Thank you.
So, are you gonna get your certification and work at the hospital?
My parents work at the hospital already. My dad's Kevin Nickerson, and
I love Kevin.
my stepmom is Bethany Nickerson. So
They fix everything for us.
so they're hoping to help me get a job there one day.
That's awesome.
It's funny that you know my dad.
It's a big hospital, but everybody knows everybody.
Yeah.
We actually take our certification next week.
Yeah.
Are you nervous? No, don't be nervous. Yes, this looks great.
Thank you.
Thank you.
All right, can you guys introduce yourselves?
I'm Samantha Ragsdale.
I'm Chelsea Menace.
Tinley Puckett.
All right, so tell me a little bit about your guys' project.
So our project is about what we have learned over the course of our EKG technician trimester. This is all the information we need to know to take the NHA exam, which it gets our certification in EKGs.
Can you tell me a little about your model and your project there?
Yes. So actually we have underneath our curtains on this one, we have the history of EKGs. So this one over here is about like what happened in the old times about it. And then the one over there is about the modern today's time. And then we have how our EKG is actually set up. She actually explains that, so we're going to switch really quick.
So with V1 and V2, you have V1 on the right side of your chest and V2 is on the left. You're going to skip V3 for right now. You're going to go to V4, which is your 5th intercostal space. And how we determine that is actually through your ribs. You're going to go back up to V3 and place that between V2 and V4. V5 is your anterior axillary line, and V6 is your mid-axillary line. And then whenever you get to your limb leads, you're going to place your electrodes on your wrist right here, and then in between your legs down at the bottom.
I'm so sorry.
It's okay.
Anyways, so this is our model. Our model is showing what we read as EKG text, how to explain what it is. These are actually interactive, so we actually have them off when someone comes over here and looks, and we put them back on. We have them put them on where they think they go. They are color-coded. The P wave is an electrical depolarization of the atrial of the heart. That is showing, with the string, is showing how the string is constricted. So that's what happens to your heart. Your heart is actually contracting in the P wave. The QRS is the impulses spreading through the ventricles. That's the QRS complex. And then the repolarization of the ventricles is the T wave, which when she releases the string, it shows the heart is relaxing. Typically, we do EKGs for when people have heart attacks. So we are reading where in the heart is happening, so we know how to fix it. So what treatment they need, if they need stents or if they need an angioplasty. I can't say that one. Can you say it? The angioplastia. Pretty much we take a ventricle of the heart, and it's burned away, so like it's no longer working, so they don't have a cardiac disorder. They might have a heart bypass surgery or a valve disease treatment or a pacemaker placed in their chest.
All right. Can you guys introduce your guys yourselves?
I'm Chloe Frederick.
I'm Grace Maravella.
I'm Kaviana Ramirez.
Can you guys tell us a little bit about your guys' poster?
Yes, so starting off, we had a pharmacy class here at EC3, and we all had to do posters. So this is just an overview of it, and over here we have modern phlebotomy. It's basically job skills, professionalism, basically what to expect if you wanted to become a pharmacist. And there's also some agencies associated with it, like the Joint Commission, some certifications that you would need. And then over here are some laws, like there's the Pure Food and Drug Act. It like monitors all the medications and stuff like that. And then down here is the different type of pharmacy settings, like outpatient, and just the differences between those. And then over here is history of phlebotomy. So it goes deeper into it so you have a better understanding of it. And that's basically everything.
Sweet. Nice job, guys.
Want to thank you for joining us on this edition of EC3 Hosa Medical Moments. And again, if you are interested in a health science career field and you are an 8th grader all the way up to your senior year in high school, please reach out to your school counselor about the possibility of getting involved in that health career field. Thank you and have a great day.